When was the last time you saw an HIV commercial that gave you crucial information about the disease, instead of a commercial that advertised HIV testing or medication? Hello, my name is Nicole Oletu, and today I'll discuss an alternative way to teach HIV awareness. HIV was prominent in the 1980s, and thanks to advancements in medical technology, the presence of HIV has been reduced significantly. However, the disease remains prevalent among low-income Southern minorities. CDC research has shown that Black and African Americans represent 13% of the U.S. population, but they account for 42% of HIV diagnoses. Hispanics and Latinos represent 18% of the U.S. population, but they account for 27% of HIV diagnoses. Why does the South have high HIV rates? HIV is prevalent in the South because of the presence of HIV stigma, high poverty rates, the lack of access to HIV education, and adequate health care. For those who don't know, HIV stigma is defined as having negative feelings and attitudes towards people who have HIV. According to the CDC, examples can include believing certain groups can get HIV, such as queer men, homeless people, street youth, and mentally ill people, and feeling that they deserve to get the disease because of their choices. According to the CDC, HIV stigma can make people feel discouraged to receive treatment because of judgment of their family, friends, or medical healthcare workers. Now that we established the affected demographic, how can we reach and teach them about HIV so that HIV stigma can be reduced? An alternative way to reach and teach low-income Southern minorities is through commercials, which brings me to my research question. Which type of commercial will make low-income Southern minority students between the ages 14 through 18 familiar with HIV transmission facts and motivate them to get tested for HIV? To discover the answer to this question, we have to go through my method. I gathered my data from a focus group and individual interviews. I gave an HIV quiz to my participants who were asked to not guess on any of the questions. After they were done taking the quiz, they will watch 5 commercials. The 5 commercials that they watched were a Prius commercial, a Get Yourself Tested Can Help commercial from Alabama Public Health, a Olive Garden commercial, a HIV prevention and testing video from WebMD, and a Bounty paper towel commercial. The HIV commercials were sandwiched between the other commercials to mimic an authentic commercial break. At the end of the viewing experience, the participants were asked to answer debrief questions regarding their experience with the commercials. A month later, I did a follow-up with my participants. The participants were given the same quiz to see if they remember any of the information they learned from the HIV commercial. After they finished the retake, the participants were asked to answer a different set of debrief questions. This is the HIV quiz my participants took from the National AIDS Trust. And this is Table 1. Table 1 shows the results my participants took on the HIV quiz to show if they have any HIV misconceptions. 27.27% of the students got 100% of the questions correctly, however they were unsure about some of the questions. 45.45% of the students got at least one question incorrectly and were unsure about some of the questions. 27.27% of the students got at least one question incorrectly and claimed they were not unsure about any of the questions. Table 1 results demonstrate low-income Southern minority students aged between 14 through 18 do not know HIV transmission facts very well. The results coincide with my assumption that low-income minorities are not well informed about HIV. Table 2 shows the results gathered from the debrief section, which illustrates the students' opinions about the commercials they watched during the method. 54.54% of the students claimed they did not learn from the commercials and would skip them. Despite this, over half of the students claimed that the Get Yourself Tested commercial, which promoted HIV testing through risky stunts, was appealing. We can assume that if informative commercials were entertaining, then younger audiences will learn from them and pay more attention. Table 3 shows the results of retaking the HIV quiz 1 month later. The results from Table 3 demonstrate 63.63% of the student scores improved after watching the HIV prevention and testing video from WebMD. Table 4 shows the students' opinions about getting tested and their experience watching the commercials 1 month later. Table 4 demonstrates the HIV facts commercial is effective. 100% of the students are willing to get tested. 63.63% of the students stated that it was through a commercial that gave them the motivation to get tested. And 72.72% of the students would share their knowledge of HIV to their family and friends. I'm not criticizing the current efforts in HIV awareness, but to suggest a way to improve it for my demographic. Currently, we are facing another threat, COVID-19. At this time, there is no FDA-approved vaccine or cure. However, there are commercials that advertise facts about the coronavirus. If we can see that is effective, why don't we do it more often? Based on the results, a specific type of commercial cannot reach a whole demographic. Therefore, I suggest we combine facts about HIV and entertainment to make HIV commercials informative and appealing to younger audiences. I challenge everyone to talk more about HIV in order to reduce the stigma. Let's take a step to improve HIV awareness and spread facts, not fear. Thank you for coming to my TEDx.